Neurology, physiology, and anatomy, the spinal cord. All right, so starting off with the spinal cord, let's understand the spinal nerves. So in total, you have 31 spinal nerves, okay? There's 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and then 1 coccygeal. All right, and a key question that they love to get you on is that nerves C1 through C7 all are going to exit above the vertebrae, all right? So the vertebral body of C1 through C7, their nerves are going to exit above, okay? But then you have an 8th cervical nerve that exits below C7 and above T1, okay? Because you don't have 8 cervical vertebral bodies, you just have 8 cervical spinal nerves, all right? And so then after that change, every other nerve exits below their specific vertebral body. So T1 all the way down is going to exit below each individual vertebral body. So T1 exits below T1's vertebral body, T2's nerve exits below T2's vertebral body, and so on and so forth. The only nerves that exit above the vertebral body is C1 through C7, and then C8 exits below C7 and above T1, which switches the rest of the nerves, okay? Now, for the spinal cord, what they like you to know is that specifically the spinal cord ends at the lower border of L1 to L2. But the question that they will ask you at is that the L4 is at the location of the iliac crest, okay? And the reason you need to know that is because that's where lumbar punctures are usually performed. So if they ask you where to perform a lumbar puncture, you could do it at L4 because you know that the normal spinal cord will end at L1 to L2, and you still need to get that CSF fluid. So without hitting the spinal cord and still getting the fluid, you're going to aim for the iliac crest, okay, at the location of L4, okay? Now, lastly, the spinal cord and associated tracts. Remember all the tracts that you learned back in the day for M1 year, talking about the dorsal column and the lateral spinal thalamic tracts, as well as the lateral cortical spinal tracts. I mean, those are necessary in understanding what's going on at a pathological level, but I'm not going to take the time to re-explain everything physiologically. What you should remember overall is that your ascending column, for example, the dorsal column is an ascending column, which brings in pressure, vibration, fine touch, and proprioception, right? And it's located in the dorsal aspect of the spinal cord. If you're in the medial aspect, that means it's going to do the fasciculus gracilis, which is the lower body, and the lateral aspect is the fasciculus cuneatus, which is going to be your upper body, okay? So the fasciculus gracilis is medial for lower extremities, and the fasciculus cuneatus is going to be lateral for your upper body, and that is an ascending dorsal columns, okay? Then on the lateral aspects of your spinal cord and more anterior, you're going to have another ascending tract known as the lateral spinal thalamic tract. This is going to be pain and temperature. And once again, we know pain and temperature have to cross over in order to get to that, in order to be sensed by the brain, okay? And it crosses over via the anterior white commissure, which may be compressed in a syrinx or syringomyelia, okay? So I'm just doing a little callback. And then lastly, you have your descending, which is located, once again, laterally, somewhat posteriorly, but laterally is the main thing to remember. And this is where you're going to have the lateral corticospinal tract for voluntary motor and movement come from, all right? Other than that, your spinal cord should be relatively easy for understanding. There's not much you need to know for the spinal cord physiology, but when we talk about the pathology, this will come into play.